So what is a reverse shoulder replacement? Well, in order to understand that, let's first talk about what a normal or anatomic shoulder replacement is. In your normal shoulder, you have a ball and a cup. The ball is at the end of your arm bone. And in order for your arm to raise up in the air, the ball has to rotate in the cup. And what makes that happen? Well, the ball rotates because the rotator cuff tendons that surround the ball help the ball rotate in the cup. If you have a tear of your rotator cuff tendons, then the ball doesn't rotate. What instead happens when you try and raise your arm is the ball translates. It can translate up, it can translate forward or backwards, and then your arm just doesn't move up in the air. The ball just shifts up in the air. It's almost like a hinge is broken on a door. You try and open the door, and instead of the door swinging open, it just shifts and moves and doesn't work properly. So you need that rotator cuff to get the proper rotation of the ball. So if you don't have a good rotator cuff tendon, then a reverse shoulder replacement can help that. And the reason it does is if you flip the ball and the cup around, the arm bone where the cup is will now rotate around the ball when you raise your arm. And the rotation works a lot better when you rotate those two parts in the shoulder replacement. So for people who have a bad rotator cuff tear plus arthritis, they have a good option to get good pain relief and still get good function in their arm. Now, there are other reasons why I might want to use a reverse shoulder replacement besides just the fact that you have a tear of your rotator cuff tendon. Another reason is if you have really bad deformity of the bone in your shoulder. So let's say the bone or the cup of your shoulder joint is really flattened or it's tilted towards the back a lot. And if you put in a normal anatomic replacement there, there's not enough bone to support it. Well, the reverse replacement has a little better fixation in the bone. So if you have a really bad deformity, that replacement will last longer. It won't wear out as soon. So for bad bone deformity, we tend to like to use a reverse shoulder replacement. Another reason to use a reverse replacement is if you have a fracture or a broken bone in your shoulder joint. It's very important for a broken bone in your shoulder joint, not only to get the bone to heal, but the tendons, the rotator cuff tendons, have to heal well in order for them to function properly. If they don't heal well, then you're going to lose function there. So typically we use a reverse replacement because then we don't have to worry so much about how well the rotator cuff heals. So again, 3 reasons you may use a reverse replacement. 1 is if you don't have a rotator cuff tendon that's working properly. 2, if you have a really bad deformity of the bone in your joint. Or 3, if you have a fracture in your shoulder. Now, let's talk about what is the difference between the rehab of both of those. Because you may have heard from friends that it's a lot easier to rehab from a reverse shoulder replacement. Sometimes that can be the case because you don't have a repair to protect after your reverse shoulder replacement. Whereas the anatomic replacement, we typically have to repair your rotator cuff that we opened up during the surgery. So we want that to heal well, and so we protect it by keeping your arm in a sling. So you may be in a sling for 4 to 6 weeks with the anatomic replacement. In the reverse, you may be in a sling for only 2 weeks. Now, in certain situations where we do a reverse, let's say for bone deformity, and your rotator cuff is still good, we'll still try and fix your rotator cuff even if you have a reverse. Because if your rotator cuff can heal and function, you'll get even more strength with that. So in some cases, you may have to be in a sling a little longer, even with the reverse. If you have a broken bone, and that's why we're doing a reverse, you are going to be in a sling for 6 weeks afterwards. Sometimes 4 if the fracture isn't as bad. Now, so those are the 3 reasons why you would have a reverse shoulder replacement. What are the risks of the reverse shoulder replacement? Because if it works so well in all these situations, why not use it for everyone? Well, there are 2 risks that don't typically happen with an anatomic replacement that usually only happen with a reverse, and while rare, they're ones that we want to avoid if possible. Those 2 complications are a dislocation of the reverse or a stress fracture of the reverse. Those can really compromise your function. There are certainly things that can be done to fix those complications, But if you can avoid them altogether, you're usually better off. The other thing is that an anatomic replacement tends to get a little more motion in the arm compared to a reverse. So that's one of the trade-offs when you reverse the ball and the cup, is that you lose some motion, especially when you reach behind your back. That's usually a little tougher with the reverse replacement. Now, you might find that before you get your replacement, you can't do that to begin with, so you won't notice that so much. But that is a subtle difference between an anatomic and a reverse. So the main benefit of the reverse and the anatomic is that they give you good pain relief and they can give you better function. And most people see a dramatic improvement between their preoperative state and after their rehab from their replacement. And so although there are some subtle differences with the rehab, there are some differences with the risks. The type of replacement that your surgeon chooses or that I would choose for you is all based on what your anatomy is and what your particular problem is. I hope this helps you understand the difference between a reverse and an anatomic.